And now what we're going to do is actually give you a chance to kind of see how the team would work together. And I'm going to introduce the next speakers. Let's see, Ben, I think you may be speaking first. Is that correct? Yep. So I've already introduced Ben, but after Ben, we'll be hearing from Bill Reddy. And these are going to be really short. You have bios, I think, of these folks. So I'm just going to hit the highlights. Bill Reddy is a nationally board-certified licensed acupuncturist and is the president of the Acupuncture Society of Virginia and has been vice president of the American Association of Acupuncture and Oriental Medicine.
Well, last but not least, my name's Bill Reddy. I'm a nationally certified acupuncturist, and I also serve on the board of directors of the Integrative Health Policy Consortium. And today I'd like to assert that acupuncture can really be a major part in combating both the opioid and the pain crisis in the United States. And so just a little about the infrastructure of what we have is that there's 34,000 practitioners across the nation. We have 60 accredited medical schools that teach acupuncture. And in terms of the U.S. News and World Report, the top 5 hospitals in the country currently have acupuncture services offered. However, it's more outpatient care. It's not like they offer 60 acupuncturists, like, not Georgetown, let's see, Johns Hopkins University has maybe 3 acupuncturists. So we're growing, and Dr. Kligler already mentioned about the VA, so I'll continue. And so we're distributed across the nation. You can see that the red states are the ones, the dark red, have the most acupuncturists of over 1,000 per state. And this is a little bit, I wouldn't take pictures of it because California, I know, have about 8,000, but this particular reference has about half that. But it does give you an idea that there are some states that we really don't have a whole lot of acupuncturists in, such as West Virginia or North Dakota, and others like Florida and New York and California do have quite a few of us. So in terms of how we do, as far as the studies of acupuncture, is that there's over 7,000 studies when you type in PubMed, and over 27,000 studies on acupuncture in terms of general conditions that we treat. And that in terms of being more effective, there's a study where they did a meta-analysis of using opioids for chronic pain, and they said they don't really recommend it. Acute pain, fine, but chronic, not so much. And that's where acupuncture is really, really powerful. And also you can see that when acupuncture is used, there's a 60% reduction in opioids. So again, we can really be part of the problem. We just need to be implemented, and we need to have regulation to allow more insurance coverage. Now, as of now, we are a essential health benefit in the Affordable Care Act in 6 states. That means 100% of insurance companies cover us. But in other states, basically people who can pay out of pocket will have our services and no one else, and that's wrong. And also something that we deal with the pain side, but we also deal with the addiction side as well. And there's a group called the National Acupuncture Detox Association. It's been around since 1975 is when they started using this protocol in New York. And at this time, there's 23 states that use it. There's over 40 countries that use this protocol as well, that uses auricular acupuncture, and it's a 5-point protocol. Very, very effective. And instead of just talking about pain, I'd also like to point out that the NIH and the World Health Organization did look at the studies. This is about 30 years ago, and you can see that everything from neurological issues to ear, nose, and throat, emotional conditions, we treat quite the gamut. And the cost is very reasonable as well. This is a few years old, but it indicates that about $75 is the cost of a treatment across the nation, which again, isn't really outlandish compared to a knee replacement, which is about 45 grand. And so the AHRQ have done a study that looked at surveys for 2 years at 89,000 acupuncture patients. And what they found was that 96% of the respondents said that they would recommend their acupuncturist to their friends or family. So that's pretty strong, and 99% said that they reported good, very good, or excellent service. So I think that that's just really outstanding in terms of just what we have to offer. And acupuncture is incredibly safe as well. It's been in the country for over 50 years. Well, actually, licensed, it's kind of spotty. We currently are licensed in 45 states, so we still are growing. But not one person has died in the past 50 years from acupuncture. And in terms of the adverse events, no one has, no real serious injuries have occurred. So what I envision is really an acupuncturist just being part of a patient-centered care model where we're working together as a team. We can have a chiropractor, we can have an acupuncturist, we can have a naturopath at the table along with the physician, and that way we can let the patient choose what they feel is most comfortable for their care. Thanks for your time.